Story that could make the millions of Americans who've tried Botox to sit up and take notice. Investigators are still trying to determine what caused 4 people in Florida to develop what they suspect is botulism poisoning after receiving some kind of anti-wrinkle injections. NBC's Don Teague reports now.
All 4 people did receive some kind of treatment at this clinic in Oakland Park, Florida last month. But authorities are still not sure what caused their sudden illnesses.
We have an ongoing investigation, but there's not much I can say at this point.
They haven't yet determined if the victims received Botox, which is FDA approved, or a counterfeit version of the drug. Published reports say investigators found documents at the clinic from a company that sells an unlicensed version of a Botox-like drug that even that company's website says is, quote, not for human use. Meanwhile, the maker of Botox says it only sold 2 vials of the drug to the clinic this year, and quality tests on the batches involved were normal. Adding in a statement, the company is confident in the worldwide safety and manufacturing quality of Botox. Many doctors are confident too, like Atlanta dermatologist Scott Corimpolis.
It's close to 100% as you can get. All potential side effects are 100% reversible. I'm very comfortable with the product.
But while Botox is considered to be safe and effective, it's also expensive. A vial this size costs about $500.
Good.
But worth it to millions of patients like Connie Whitaker.
It's wonderful.
The key, says Corimpolis, is for patients to make sure their doctors are using the name brand Botox, not risking their health by trying to cut costs.
Super.
For today, Don Teague, NBC News, Atlanta.
Dr. Doris Day is a board-certified dermatologist practicing in New York City, and she's been treating patients with Botox for nearly 10 years. Dr. Day, good morning.
Good morning.
Love your name, by the way. But moving on, let's clarify about Botox. It's the brand name, actually, of an injection that's made by a company called Allergen, and it's approved by the FDA. What are the chances of getting botulism poisoning from Botox?
Okay. In order to even think about toxicity from Botox, you would have to inject, each vial has 100 units, and that's for every vial. It's always the same. You would need 10 vials or 1,000 units into the vein directly to consider Botox toxicity. So from the amounts that we use for medicinal purposes and for cosmetic purposes, it's virtually impossible to have that as a reaction.
Which raises the question then, as Don Teague did in his report, did these people get counterfeit Botox? Here's what's alarming. Last year, an FDA investigation found that black market botulism shipments were coming in from all over the world, and much of it from China. Has the demand for this very, very expensive kind of treatment, has the demand caused then the potential for this counterfeit kind of, that fake Botox is being now more widely available? Is that what's happening today?
Well, I think whenever you have a high demand and a lot of excitement about a product, and there are so many great things about Botox and what it can do in terms of both medicinal and cosmetic uses, you do create a market for people who may not have the ethics that your physician or your dermatologist would have, which is why you need to really be careful in making your choice. You want to make sure that it's a dermatologist that's board certified or a plastic surgeon that's doing the treatment. You want to ask them the questions and be comfortable as.
Okay, so let's go down that list, because I think that's very important for people to know what they should do to protect themselves now in light of this availability of counterfeit Botox and these other issues. You say, as you just said, that you need to make sure that you're seeing a board-certified dermatologist or plastic surgeon.
Right.
Nobody else.
That's absolutely true. When you see somebody who is trained in skin physiology, that understands exactly the mechanisms of action of Botox, it's a very, very well-defined product. So we know exactly how it's working, we know exactly what it does, how long it lasts, what the potential side effects are. And you should really have that explained to you very clearly to make sure that it's right for you. Botox is not for everybody, and you want to make sure you have that discussion to make sure it's right for you.
All right, so make sure that you always ask questions about the side effects, risks, and results. And also find a doctor who administers Botox frequently, and don't allow an assistant to actually administer the Botox to you.
Absolutely. This is a medical treatment. It should be administered by your treating physician, and that's very important. And the reason that I think it's important to have someone who does it regularly is because once we reconstitute the vial of Botox, it needs to be used within a certain time frame. So if someone is just doing it once a month, chances are they may not be going through or doing as many treatments as someone who's doing it on a regular basis every day or every week.
Another clue is if you're getting cheap, quote-unquote cheap Botox. Botox costs, what, $500 a vial from the company to the doctors.
Exactly.
And per treatment, you should pay at least that amount of money? Is that what, it could be much higher than that,
right.
but that's the low end?
Exactly. It starts at about $500. And what happens is that if somebody's offering you Botox at a lower price, there's a couple of things you have to be concerned about. Either you're not getting the real thing, which is a huge concern because this is not a place where you cut corners. Save your money, choose what you want to do, and do the right thing for you, make sure it's right. But also, it may be that you're not getting enough, because if the doctor's going to be doing it, or the person who's going to be injecting it is doing it for less, it's going to cost them money. That doesn't make sense.
Right.
So either they're going to tell you what you're going to find out when you get there, that it's much more than you think, or you're going to find out that it, unfortunately later from other side effects, that it might not be what you think, which is much worse.
All right, Dr. Dorsey, thank you so much for keeping people safe.
Thank
you so much. And up next, buy one car, get one free. Is it for real, or are car dealers trying to